All right, Rescue 1, respond to an unresponsive man in the parking lot of the Eckerd's, at Wheeler Road at Augusta West Parkway.
Copy, on scene. My partner I have on PPE BSI. Is our scene safe?
Scene is safe.
I see one patient. How many do I have?
One,
MOI, NOI.
patient is unresponsive, no other information.
I don't see an indication for additional resources. Send fire department for first response. He's unresponsive. We're going to go with cervical precautions. Take C-spine. What's my general impression? Do I detect any life threats? Do I see any major bleeding?
No life threats, no major bleeding.
As I approach my patient, does he look at me?
Negative.
He's not alert. Sir, can you hear me?
No response.
I pinch his earlobe. Is there a response?
No response.
At this point, I have an altered level of consciousness, and I like to identify a load and go situation.
Load and go.
I'm checking his airway. Do I have any adventitious sounds? Does it appear to be patent?
You do not have an open airway.
Okay, do a jaw thrust. Okay. Is my airway patent now?
Airway is open and patent.
Okay, maintain the airway with a jaw thrust and C-spine. I'm checking breathing. Is he breathing?
He is breathing.
Rate, rhythm, and quality.
He's breathing 12 times a minute. He is breathing regular and adequate tidal volume.
I have good tidal volume.
Yes.
Good. We will administer oxygen via non-rebreather at 15 liters per minute. Since we're having a challenge maintaining an airway, I will insert a nasopharyngeal airway after sizing it appropriately. Circulation, do I have a radial pulse?
You do.
Rate, rhythm, and quality.
Radial pulse is regular. It's strong at 60.
Good. I'm touching the skin. What is its condition?
The
Color
skin,
and temperature.
It's dry and warm.
Blood circulates. Do I see any large pools of it?
Negative.
I'm making a decision that this is a load and go based on an altered level of consciousness and breathing issues. I'm going to proceed with a rapid body scan starting with the head. I'm going to feel his entire head for decap, BTLS, and I'm going to look into pupils for reaction. Are they?
Pupils of pearl, no decap.
Checking the nose for drainage.
Negative.
Checking the mouth for drainage or foreign objects.
Negative.
Back to the eyes for raccoon eyes.
None.
Looking in the ears for drainage or Battle's sign.
None.
Proceeding to the neck, going with decap, BTLS, tracheal deviation,
Trachea's midline.
jugular vein distension,
No JVD.
cervical step-off.
No cervical step off. No decap.
We will apply a properly sized cervical collar. As we're going to expose our patient. We're going to look before we touch. I'm inspecting the chest. Do I see any decap BTLS?
No decap BTLS.
I'm going to palpate the shoulders, the clavicle, the chest. I'm going to feel for an inspiration and an expiration. Do I have any paradoxical motion or flail segments?
You have no paradoxical motion or flail segment.
Before I leave the chest, I will auscultate breath sounds. Are lung sounds present, clear, and equal bilaterally?
They are clear and equal bilateral.
Are heart tones crisp or muffled?
They're crisp.
Moving on to the abdomen, continue to expose. I'm looking at all four quadrants, any decap BTLS.
No decap BTLS.
Palpate, checking for rebound tenderness, any other tenderness, guarding, rigidity, or distension.
Negative.
Continuing to expose at the pelvis, any decap BTLS.
No decap BTLS.
Press in, down, back of the hand for a priapism. Check the symphysis pubis. Are we intact?
They are intact, no crepitus, no proper.
Lower extremities. Going to expose the lower extremities. As I do that, I'm going to check the extremity for decap BTLS. Do I have any?
None.
Off with his shoe. Checking for a distal pulse. Is it present?
You do have a pedal pulse.
If he was responsive, I could check for motor and sensory function. Going to the other leg, checking for decap BTLS.
Decap BTLS.
Moving the shoes, checking a distal pulse. Is it present?
You do have distal
He was
pulse.
responsive. We could do motor and sensory if my first responders got here.
First responders on scene.
Good. I need one to get a backboard, one to get a sample history, and one to begin getting vital signs.
Okay. No sample history available. Backboard's here.
Thank you, sir. I'm checking the arm for decap BTLS, checking
Clear.
the presence of a pulse.
You do have a pulse.
Motor and sensory, hard to get due to unresponsiveness. This side, give me one of my first responders over here. Checking decap BTLS. Do I have a pulse?
You do have a pulse.
Can't do motor or sensory.
Clear decap BTLS.
Cervical collar has been applied. Sir, We're gonna come up on the headman's count.
On three. 1, 2, 3.
Without moving my hand from his shoulder, I'm gonna reach up past the C-collar, down the spine, over the buttocks, the back of his thigh. Coming back here, do I have any decap BTLS penetrations or injuries to his posterior surface?
Clear decap BTLS.
Down on
Clear,
you?
no
Down on 3.
penetrations, no other
1, 2,
injuries.
3.
Is he centered on the backboard?
Yes.
I will strap him chest, hips, thighs, head last, secured to the backboard, on the stretcher, in the ambulance, en route.
Clock stop.
I need a blood pressure, I need a pulse, I need respirations. I'm going to continue to reassess, check for any vital interventions, check my assessment. How far am I from the hospital?
15 minutes.
15 minutes. What's the blood pressure?
Blood pressure 120 over 62.
Pulse,
Pulse is still 60 in regular.
respirations,
Respirations.
rate, rhythm, quality, tidal volume.
Respirations are now 16 and normal. He has adequate tidal volume.
Do I have enough oxygen left in the cylinder?
Yes, you do.
Skin condition, color, temperature.
He's actually warm and dry still.
Good,
And
ventilation is good, he's been immobilized, he's on oxygen, we haven't found any other injuries, let me go ahead and call the hospital. I'll give my radio report, we'll continue in transport, reassessing every 5 minutes. This is an unstable patient due to an altered level of consciousness. Is there anything else?
No.
Done.